Hello, I'm Dr. Gerald Chodak and this is prostatevideos.com. In this video, I want to talk about participation in clinical research studies. As you can understand, the only way doctors can make progress is by doing properly controlled studies, especially when testing new types of treatment or new types of tests. In order for those studies to get done, it requires that patients such as yourself participate and sign up. Now, one of the obstacles to many of these studies is that they're often comparing a new treatment to a control, which often involves a placebo. A placebo is an inactive treatment. It's like taking a sugar pill. And so if you have a particular disease or your cancer is progressing in some way, you may be offered something that has no effect at all. It's important to know the only time we would use something like that is when doctors do not know whether a treatment will help you. You will never be deprived of something that will improve your survival in order to get this study done. So doctors will take the best treatment available at the time and compare it to something new. When there's no clear evidence that some treatment will help you, that's when a placebo or inactive treatment will be used. So why do this? Well, a couple of reasons. Number one, it might actually help you. A new drug has to go through proper testing, and preliminary studies would be done first if there's any activity or potential benefit. And the only way to proceed is to do the next level of investigation. If you want to participate by getting one of these newer treatments before the FDA approves it, then you would have to be getting it on as part of a trial. That's the only way you can get a new drug. So it has the potential to be helpful to you because without it, you might be progressing. The other thing is, of course, it may be helpful to other people with this disease, so you can contribute to society in some way if you join a clinical trial. Sadly, only about 5% of men in the United States are participating in clinical studies for prostate cancer. And there's several reasons for that. Number one, many patients are reluctant because they don't know enough about a study. Number two, doctors don't inform men about studies that might be available, nor do they encourage them to participate. And number three, there's just a general sense or reluctance to participate in research, and that's a sad fact. So, my message is, participate in a trial if you can, particularly when there's no clear best option on how to manage you. And the best way to find out about it is check with the nearest university. You can go on the U.S. government public website at National Cancer Institute, and you can type in your type of tumor and the stage of your disease, and it will tell you what studies are registered around the United States that you might be eligible for. And at least get the information about a study to see whether or not you might be interested in participating. It clearly has many benefits, and as I said before, it's the only way to get something new before it's routinely available. I hope you find this information useful, and thank you for watching.